So today I'm going to talk about the drug policy reform. And right now, the current goals of this reform are to make any proposed changes to the way governments respond to the socio-cultural influence on perception of psychoactive substance abuse. So here is some background information. The drug policy reform is sort of like a response to the war on drugs. And the war on drugs refers to the efforts by government over the last 50 years to prohibit and penalize drug use, possession, transportation, sale, and production. Annually, the United States spent more than $51 billion on the war of drugs. However, based on recent statistics, it's evident that the whole idea of prohibiting and increasing consequences of drug use is not working. The number of people arrested in 2012 in the US on nonviolent drug charges was 1.55 million. The total US prison population has more than quadrupled in the last 30 years. And not only that, but the number of Americans incarcerated in 2012 is 2,228,400, which is 1 in every 108 adults. And that is the highest incarceration rate in the world. In 2011, someone in the United States was arrested for marijuana every 42 seconds. The economic costs of drugs are also huge. In 2007, illicit drug use cost our nation more than 193 billion in lost productivity, healthcare, and criminal justice costs. However, the human costs are worse because drug-induced overdose has now surpassed homicides and car crash deaths in America. And these are some of the reasons why there was this call for reform. So some of the people involved in furthering this reform are Pamela Rodriguez, Scott Strode, and Dr. Stephen Lloyd. Pamela Rodriguez is the Executive Vice President of the Treatment Alternatives for Safe Communities, TASC, which is a national organization that connects drug addicts to treatment programs. Rodriguez is a deeply religious woman, and she believes that it's important to have second chances. When Rodriguez was in high school, she made friends with a variety of people, and that included kids who did drugs. And she felt that she saw something worthwhile in all of them, and that there was a lot of prejudice against those who were different. And that sort of serves as the guiding principle for the whole TASC movement. TASC comes at substance abuse from a social justice mindset and recognizes that our criminal justice system has turned into our safety net. Rodriguez basically believes that we are all human beings and that we all have flaws. The second person, Scott Strode, has dedicated his life to helping individuals with substance disorders find and maintain their recovery through sports. He developed his approach actually from personal experience. He started drinking when he was just 10 years old, and by 15, he was doing cocaine. It later dawned on Strode that if he didn't change things, he was going to overdose. So he abandoned all sorts of drugs and founded Phoenix Multisport in 2007. This is a safe, supportive, physically active community for individuals recovering from alcohol and substance abuse and choose to live a sober life. Through pursuits such as climbing, hiking, running, mountain biking, Phoenix seeks to help its members develop emotional strength to stay sober. The third person is Dr. Stephen Lloyd, who is an internal medicine physician and medical educator with expertise in proper prescribing of controlled substances and substance use disorders. Lloyd practiced medicine on patients while high on narcotic drugs for 3.5 years. His patients were lucky that he was surrounded by other doctors and nurses that guided him and questioned his actions. Lloyd became addicted to prescription narcotics and was taking about 100 pills a day, including oxycodone, Vicodin, Valium, etc. Someone did finally call him out, so Lloyd has now been sober for over 10 years and is currently working to educate other physicians about safe prescribing practices. Right now, here is President Obama's plan to reform drug policy, which is to prevent drug use before it ever begins through education, expand access to treatment for Americans struggling with addiction, reform our criminal justice system, and support Americans in recovery. The Obama administration's plan to reduce drug use and its consequences represents a 21st century approach to drug policy. Some things this policy has already accomplished is that lawmakers from both parties have now been more open about reducing prison population. And as I just mentioned about the three people, there are now many established organizations all dedicated to help those who were struggling with drugs.